Hello, my name's Dr. Justin Amery, and I'm doing a series about coronavirus, talking about hoping for the best but preparing for the worst. And in this video, we're going to look at some facts and figures around coronavirus, because without facts and figures, it's really difficult to make good decisions. And right now, we all need to be making the best decisions we possibly can. Just a little bit about me. I'm called Dr. Justin Amery. I'm a family doctor or GP in Oxford in the UK. I'm also a palliative care doctor, working mainly with children coming towards the end of their life and also with adults. I've been doing both for 25 years, so I've got a lot of experience both working in the UK and abroad, particularly in Uganda. I'm currently sitting at home isolated, having been suffering with coronavirus, which fortunately for me was a mild illness, and I hope it is for you too. Because I'm a bit bored and because I wanted to try and do something, I thought I'd do a series of videos, because I know from my experience that there's a lot of people sitting at home really frightened and anxious about this coronavirus. And for most people, you don't need to be, because if you get it, it'll be mild. But for some people, it will make you seriously unwell and could potentially kill you. And even for that terrible outcome, I can still provide a lot of comfort if you continue watching these videos, because in my experience, our fears about death and dying are way worse than the realities. And by talking about those fears, discussing our concerns and coming up with some plans and suggestions, we can feel a lot more comforted by it. So remember, the truth is that the vast majority of us will survive this virus. Some may not go on to die, but the idea of this series is to just hopefully give a bit of comfort and relief to those who are anxious, particularly those who are home alone, frail and elderly. So the point of this video is to give you some facts and figures. Why give you facts and figures? Because it's really, really important that you are informed. Because if you're not informed, you can't make informed decisions. And informed decisions are going to be crucial over the next few weeks. So I'm going to give you some facts and figures to try and put things into perspective. The first fact might be a little bit frivolous, so please forgive me, but it's quite important actually, because it's something we tend to all know, but we put it to the back of our minds. So in terms of what's the death rate of being alive, it's 100%. The mortality rate of a life is 100%. Each one of us is going to die at some point. We all know it. Many of us choose to avoid thinking about it for good reason. But actually, as long as we don't let it tyrannize us, the knowledge of our own death is actually quite an effective way of ensuring we live the best life we can and keep things in balance and in perspective and try and dedicate our lives to what's important. Here's another statistic. Every year across the world, nearly 60 million people die. 60 million people, pretty much the entire population of the UK, every year will die. That's a lot of people. So that helps maybe keep coronavirus in perspective. We're hoping that nothing like that many people will die of coronavirus. Here's a very positive statistic. Even, I'm sure people have read the details, everybody's heard about the fact that coronavirus is much more dangerous for elderly people or people with other health conditions. But let's have a look. Even if you're over 70 with pre-existing conditions, your chance of survival, if you get coronavirus, is still 90% or more. That's as far as we know so far. It may even be better than that, because right now we don't actually know how many people have the virus who don't have symptoms. So the rates that we're coming up with are probably a little bit distorted. But still, that means 10% of people in the elderly age group won't survive, and that's a very sobering statistic. That means there will be a lot of people in the UK and around the world who won't survive. Remember, the number of people who don't survive coronavirus is only going to be a very small fraction of the people that would have died anyway during the year. But nevertheless, because it's come in a wave of a virus, it's also come along on a wave of anxiety, particularly in the Western world, where we're not so used to talking about death and dying, and these epidemics are not really so much part of the fabric of our lives. Having worked in Uganda at the very height of the HIV/AIDS epidemic, where they also have to cope with malaria and other much more virulent outbreaks, I find that people tend to have a much more sanguine approach to life and a much better balanced approach to life. But nevertheless, wherever you are in the world, confronting your immortality is quite frightening. So let's what happens if the worst happens, if your heart stops beating and if your lungs stop working, you're going to die unless someone resuscitates you. And it's important to understand the facts and figures around resuscitation, because a lot of people think from watching TV that if your heart stops beating, people will run around, they'll jump up and down in your chest, they'll blow in and out of your mouth, they'll get those electrodes and they'll stick those in your chest and they'll zap you and boom, you'll be sprung back into life just as you were before. Unfortunately, the reality is nothing like that. Most people think your chance of surviving resuscitation is 75%, 80%, something like that. The truth is, if your heart stops at home for any reason and someone resuscitates you, your chance of survival from that resuscitation immediately is about 10%. So 90% of people just won't get the resuscitation. And of the people that do survive, only about 3 to 4% of people will survive a year. That's because people's hearts and lungs don't just stop beating for no reason. They stop beating because people are ill or because there's something wrong with the heart or the lungs. And those problems don't go away just because you resuscitate someone. And what's more, during the period where the heart and the lungs are not beating, very often damage happens to the brain and other internal organs, which makes the quality of life left much worse and certainly shorter than it would have been without resuscitation. So resuscitation in the community is not very successful, and survival for a year after resuscitation is even less successful. In hospital, things are a bit better, but not much. In hospital, if you get resuscitated, your chance of surviving immediately is about 20%, because there are more people around with more machines that can do more things. But again, the chance of surviving a year is still only about 5 to 6%. So it's important to recognise that if with coronavirus you get so sick that your heart and lungs stop, the chance of resuscitation is quite small. And furthermore, when you've been resuscitated, you will almost certainly have to go onto a ventilator in an ITU department, which means almost certainly the doctors are going to have to take over the breathing from your lungs. And it might be difficult for you to get off the ventilator, and you may well die in ITU. Now, these are sobering statistics and are important because when it comes to making decisions about whether we want to be resuscitated, you kind of have to think about where you are in your life and what's important to you, because there's no wrong or right answer. You might want everything done, or you might want just to be kept peaceful and allowed to die naturally and with dignity. So it depends where you are on the spectrum. Here's the kind of spectrum that I think most of us are aware of. At one end, some people, depending on where they are in life, want the doctors to throw everything at it and keep them alive at all possible costs. At the other end, some people feel, I've had a good life, I don't particularly want to die on a ventilator or in the ambulance or in the casualty department. I'd like to be allowed to die with dignity, peacefully and comfortably in my own bed, in my own house, surrounded by the people that I love. This next statistic is really important, and this is perhaps the most important statistic, that if you don't tell people what you want to happen, in the vast majority of countries, the go-to position is ambulance, casualty, resuscitation, ventilation, intensive care unit. That's just how our societies are set up. Because if we're not sure what people want, we assume they want everything. In fact, if you ask people where they would prefer to die, about 90% of people say they would prefer to die at home and not in hospital. However, despite the fact that 90% of people would be preferring to die at home, only about 20% in the Western world succeed in doing that. That means 70% of people don't die where they want to die. They die in an unfamiliar place, surrounded by unfamiliar people, attached to unfamiliar kit. It's certainly not the death I want. I suspect it's probably not the death you want. I might personally go there if I felt it was really, really important to me to be alive, because I've got dependents or for lots of other reasons. However, at the point where I think, you know what, if I get that sick, my heart stops beating, my lungs stop working, do I really want to end my life on a ventilator? This has been a hard conversation, but now you've got the information, you can make an informed choice. Once you've made your informed choice, you can make a plan. Because if you don't plan, what I think I've shown, I hope I've shown, is that you won't necessarily get what you want. If you want to make sure that your choice happens, you need to plan. And we'll talk about that in the next video. This has been a tough video because I've had to share some quite nasty statistics with you. But remember the first one, you've got at least a 90% chance of surviving this virus if it happens. And if the worst comes to the worst, we can make sure that your death is peaceful and dignified at home, without suffering, with your loved ones and in your own bed, if you make the choice. Please do watch the other videos in this series and we talk about some of those things in a bit more detail. Remember, what we're trying to do here is hope for the best. So stay hopeful, stay positive, but we're also preparing for the worst. So don't bury your head in the sand, think about what might happen. Most importantly, please, please, please share this video with your friends and family. Ask them to watch all of the ones in this series, and try and get everybody you think who might be frail or vulnerable to make a plan. Take care, and I'll speak to you next time.